Opportunity to welcome you all on behalf of Hetero Healthcare. My name is Rajamanikam, Senior Sales Manager of South Hetero Healthcare, Helium CNS Division. First of all, I'm thanking you all for joining us today to discuss on the topic lasmiditan in the treatment of migraine. As you know about Hetero Healthcare, we are the largest R&D wings with having 360-degree solution provider. More than 25 years of excellence in multiple therapies, currently present in more than 125 plus countries worldwide, more than 200 products across various therapeutic categories such as HIV, AIDS, oncology, cardiovascular, and neurology. Distinction of bringing 4 biosimilar products to market, 36 plus state-of-art manufacturing facilities, and pioneering in quality and innovation. And today is Teachers' Day, an app day. The speaker we have Dr. S. Balasubramanian, a senior consultant neurologist, is a student of our chairperson and moderator, Professor Dr. M. Javahar, a good combo of Guru Sishya today. Now I introduce the chairperson, moderator, Professor Dr. M. Javahar, senior consultant neurologist, retired recently a month back from the Institute of Neurology of Madras Medical College, retired as a unit chief, currently working in Bethesda Hospital and Kosh Hospital of Tambaram, and he is having more than 27 years of experience and rendering service as a notable neurologist in Tambaram and surroundings of Chennai. By look, he will look like not look like a retired professor or unit chief. He's a very simple and a humble teacher, professor, doctor, and above all, a best human being. Doctor, over to you to share your experience and moderate the session, and kindly introduce our speaker and your best student, Dr. S. Balasubramanian. Yes, sir. Over to you.
Thank you, Race Manager Mr. Rajamanikam. Kind introduction. I am really happy to participate in this function on behalf of Hetero Healthcare Division for the product introduction at lasmiditan. And actually, the apt speaker, Dr. Balasubramanian, I welcome Balasubramanian. I know him since 2007 when he was a postgraduate student in Madras Medical College. He's a very good academician, knowledgeable person, calm and quiet person. And he has worked as assistant professor in various medical colleges like Kilpauk Medical College and Tamil Nadu Multi-Speciality, Super Speciality Hospital at Omdura, and also in Madras Medical College. And he has presented a lot of scientific case presentations and presented published papers. And he is now a successful consultant, working as a consultant neurologist in so many corporate hospitals. I welcome Dr. Balasubramanian to talk about this topic on lasmiditan.
Thank you for your kind words, sir. Good evening to all. First, I would like to thank my teachers and colleagues for participating in this webinar, especially my teacher, Professor Javahar, for moderating this session. Thank you, sir. I would like to thank Hetero Healthcare for giving this opportunity to talk with my friends and teachers. Thank you. Just I'll share the screen. So today's topic is usage of lasmiditan in the treatment of migraine. This is a newer drug launched in the armamentarium of migraine treatment, acute treatment of migraine. It has a very good role in controlling the acute migraine headache. So before going into the details about lasmiditan, first we'll go refresh our knowledge about migraine. We all know that migraines are common disabling primary headaches. They are more prevalent in women than in men and are accompanied by significant disability and healthcare costs. The migraine typically occurs in episodes, and these episodes generally persist 4 to 72 hours and are often accompanied by symptoms such as nausea, vomiting, photophobia, and phonophobia. In some cases, migraine may be preceded by a brief aura. The exact cause of migraine is currently unknown, but it is thought to result from release of pain-producing inflammatory substances around nerves and blood vessels at the head. Migraine affects over 1 billion people worldwide. It brings significant burden and disability. So, though there are many medications available for acute migraine treatments, there are certain limitations also. The traditional effective acute migraine treatment includes paracetamol, non-steroidal anti-inflammatory drugs, ergots, and triptans. While these therapeutic agents are effective in many individuals, particularly in mild to moderate migraine headaches, these are definitely effective. They fall short from complete resolution and carry significant side effects also in certain group of patients. In addition, overuse of acute medications can lead to medication overuse headache and chronicity of migraine also. Triptans are the current standard care of addressing acute migraine attacks of moderate to severe intensity. Nevertheless, they are contraindicated for individuals with cardiovascular risk factors because triptans act through 5-HT1B and D receptors. They produce vasoconstriction. So there is risk of vasoconstriction in patients with ischemic heart disease. So triptans are mostly avoided in those with severe ischemic heart disease. Many patients experience inadequate efficacy or tolerance issues with triptan therapy, creating a substantial unmet need for an alternative acute migraine treatment. This need led to the development of lasmiditan, a potent and selective agonist of the 5-HT1F receptor. The triptans are 1B and D receptor agonists. This lasmiditan is a 5-HT1F receptor agonist. So what are all the unmet needs in migraine therapy? So we need faster onset of action, improved efficacy, better tolerability, effective treatment for patients with comorbid conditions like cardiovascular disorders, and we need solution for refractory or chronic migraine patients. In this situation, the lasmiditan was launched. It is US FDA approved in 2019, recently launched in India. It belongs to a novel group called DITAN. So lasmiditan is a group of, comes under the group of DITAN, and this is highly selective to the 5-HT1F receptor. This is a serotonin receptor, one variant of serotonin receptor. Lasmiditan is highly selective, that is 400 times more selective to 5-HT1F receptor compared to 5-HT1B and 1D receptor. And the triptans act through 1B, 1D receptors. This 5-HT1F receptor does not have the action of vasoconstriction. So these DITANs are relatively safer in patients with cardiovascular issues and other peripheral vascular disorders. They act through G protein signaling that leads to the inhibition of calcitonin gene-related peptides, CGRP, and glutamate release. These CGRP and glutamate are the recently identified root cause for migraine headache. They activate certain pathways and that result in migraine headache. Both CGRP and glutamate are involved in peripheral and central pain signaling pathways. CGRP centrally increases sensitization of nerve fibers, resulting in more severe headache. Peripherally, it contributes to the dilatation of meningeal arteries. The vasodilatation also leads to the migraine headache. By acting as an agonist at 5-HT1F receptor, lasmiditan inhibits CGRP release and activation. So it prevents, it is a potent treatment for acute migraine headache. The 5-HT1F receptor also acts through another mechanism. It is said that it plays an important role in mitochondrial biogenesis because mitochondrial dysfunction has been found to be one of the reasons for migraine headache. This lasmiditan acts through this mechanism also. The pharmacokinetics, oral bioavailability of lasmiditan is about 40%, 40 to 60%. It can be taken with or without food. Peak plasma concentration is reached in 1.8 hours and onset of action is relatively faster, 30 to 60 minutes. It is metabolized by non-CYP enzymes. Hence, there is less risk of drug interactions. This is a mechanism of action of lasmiditan. As we have already seen, it blocks the release of CGRP. The lasmiditan has shown efficacy in rapidly alleviating migraine symptoms. In many patients, within 30 to 60 minutes, there is relief from headache. But also it improves the associated symptoms like nausea, photophobia, and phonophobia also. It was approved in 2019 for acute treatment of migraine. Before being launched, it underwent many phase trials like phase 2 and phase 3 trials. In phase 2 trials, which are done to identify dose finding and proof of concept studies, this lasmiditan phase 2 trials showed a very good headache response at 2 hours. Significant efficacy was noticed at 100, 200, and 400 milligram doses. Also, it was done with intravenous administration also. It also showed good results. So the intravenous drug is not yet launched. It was not yet approved for common use. No serious adverse events were reported in phase 2 trials. Most adverse events, if at all reported, are mild to moderate intensity. They improved over a few days, 2 to 3 days, they improved. Unlike triptans, there was no vasoconstrictive effect, and so resulting in cardiovascular complications. The safety and tolerability profile from phase 2 studies was crucial in determining the doses to be used in subsequent phase 3 trials and in establishing the overall risk-benefit profile of lasmiditan. So there are 3 main phase 3 trials called Samurai, Spartan, and Gladiator trials. These are the clinical trials designated to evaluate the efficacy, safety, and tolerability of lasmiditan, a selective serotonin 5-HT1F receptor agonist. And all these 3 studies, Samurai, Spartan, and Gladiator studies, showed that there was a significant pain relief within 2 hours with this lasmiditan compared to placebo. The most bothersome symptoms were also relieved better within 2 hours in a lasmiditan group. The safety aspect was better. Common side effects included dizziness, fatigue, and paresthesia, which are generally mild to moderate. The Spartan trial also had shown similar results compared to this Samurai trial. The Gladiator trial was done to identify the long-term safety and efficacy of lasmiditan. It also showed a good result without much significant complications. There were no treatment-related serious adverse events, no cardiovascular adverse events. And the common treatment emergent adverse event noticed were dizziness, somnolence, and paresthesia. These side effects also decreased with subsequent usage of lasmiditan. 12 to 12.8% patients discontinued due to adverse events. So this study also showed the similar pain freedom, most bothersome symptom freedom in 2 hours. All these studies showed lasmiditan 100 and 200 milligrams were better efficacious than 50 milligrams. The interim results showed intermittent lasmiditan 100 and 200 milligrams to be generally well tolerated and efficacious for acute treatment of migraine over a 1-year period. Safety and efficacy results were consistent with previous single attack studies. Post-marketing surveillance was also done. Post-marketing data has continued to support the efficacy and safety profile of lasmiditan as noticed during the phase 2 and phase 3 trials. Real-world evidence from patient reports and healthcare provider feedback was taken for post-marketing surveillance. The efficacy, like before, there was effective migraine relief within 2 hours. It was relatively safe. The unique mechanism of action, the 5-HT1F receptor agonist action, it's like unlike triptans, which target 5-HT1B, 1D receptors, and may lead to vasoconstriction. Lasmiditan specifically activates 5-HT1F receptor, so does not cause vasoconstriction, so which is particularly beneficial for patients with cardiovascular risk factors. So this makes lasmiditan safer for a wider range of patients. The same safety profile, cardiovascular safety, is established. Mild side effects like dizziness, fatigue, paresthesia. There is rapid pain relief, relief of most bothersome symptoms. Lack of medication overuse headache in lasmiditan compared to other acute medications. There is improved patient outcomes. It enhances quality of life due to the combination of effective migraine relief, safety, and tolerability. Broader patient suitability because of the no vasoconstrictor effect. It was useful in cardiovascular patients also. The key findings from another study called Centurion study. This study also showed it is effective and safe for patients who do not respond adequately to triptans. This another study, randomized control trial of lasmiditan over 4 migraine attacks. Previous studies were for single migraine attack. This study was done over 4 migraine attacks to see the effectiveness of lasmiditan over multiple attacks. This study also showed the same results. More patients reported feeling much better or very much better, and patient global impression of change with lasmiditan versus placebo at 2 and 24 hours. Comparative analysis, lasmiditan versus triptans. So as we have seen, mechanism is more selective, 5-HT1F receptor agonism. Safety and efficacy is better. Safety is better, efficacy is comparable to triptans. Compared to NSAIDs, there is lesser gastrointestinal renal side effects. More efficacious treatment is seen in lasmiditan. Compared to ergots also, lesser side effect, more efficacious treatment is available with lasmiditan. So lasmiditan offers significant advantages over other available drugs for migraine treatment. Its unique mechanism of action, superior safety profile, rapid efficacy, and suitability for a broad range of patients make it a valuable addition to the arsenal of acute migraine therapies. The persons, particularly those with cardiovascular risks or those not responding to other treatments, lasmiditan proves an effective and safer option for managing acute migraine attacks. So there are few case studies also there. The case study 1, there is a 45-year-old female with cardiovascular risk factors. She was previously on other painkillers and triptans. So as we have already seen, lasmiditan is superior compared to other medications in patients with cardiovascular risk. So it is significantly better compared to triptan and other drugs in patients with frequent migraines also. We have seen that over multiple episodes of migraine, it is more effective and lesser side effects are noticed. In patients with migraine and depression, so lasmiditan is preferred because of its lesser interaction with SSRI drugs. In patients with menstrual migraine, here also the lasmiditan are superior. The triptans are equally effective, but lasmiditan has lesser side effect compared to triptans. So it gives good relief to patients with menstrual migraine also. To summarize lasmiditan, it is efficacious as we have seen. It demonstrates rapid and significant relief of migraine symptoms, including headache, nausea, vomiting, photophobia, phonophobia, within 30 to 60 minutes of administration. Safety aspect, clinical trials and post-marketing surveillance indicate a favorable safety profile, with most adverse events being mild to moderate and transient. No significant cardiovascular effects are noticed. Patient outcome, those who do not respond or cannot take triptans have taken lasmiditan, and it is expanding the therapeutic options for them. Improved quality of life is a important aspect of treatment of migraine. So lasmiditan improves quality of life. So lasmiditan offers a promising alternative for acute migraine treatment, particularly for patients with cardiovascular concerns or contraindications to other therapies. Thank you. Thank you for watching this webinar. If you have anything to be clarified, you can.
Thank you, Dr. Balasubramanian.
Thank
Wonderful speech on lasmiditan, and clearly explained the benefits of lasmiditan compared to the triptans, and what are the advantages, and what are the minimal side effects. All these things you explained very well. And really, the excerpt from your speech is the advantage from over the triptans. The lasmiditan, what are the advantages? One is you can give the lasmiditan in those patients who are having cardiovascular risk and stroke risk, or a person having any peripheral vascular disorder like Raynaud's phenomenon and other things. And one another thing, that patient already is taking SSRI for depression, is the best drug that you can combine with. The lasmiditan can be combined with the SSRI, but the triptans will have a problem with the SSRI. They can develop a serotonin syndrome. And another thing, by taking a lasmiditan, the symptoms, it not only reduces the headache, it also reduces the other migraine problems like photophobia, phonophobia, nausea, and all these things. So it's definitely, it has got a very good relief of symptoms in all migraines. So, and also the overuse headache, which is much more in a triptans, but this overuse headache also is very less in lasmiditan. So all these points you clearly explained, and these are the advantages. And there are certain questions now in the chat box. We'll go to the chat box now. First question: what percentage of your patients experience significant pain relief within 2 hours of taking lasmiditan? Dr. Balasubramanian.
Yes, sir. Around 60 to 80% of patients get significant pain relief, sir, within 2 hours.
2 hours. That dosage you prefer is how much commonly you can prefer dosage? 50 milligram or 100 milligram or something like that?
I started using 50 milligrams, sir. So 100 milligram is better than efficacious than 50 milligrams.
Then next question is, which specific scenarios or the patient conditions would you choose lasmiditan over triptans or CGRP antagonists? So
definitely lasmiditan are superior to triptans in patients with the cardiovascular risk factors and other peripheral vascular disorders, sir. The side effect profile is also less here. The sedation is there. The patient should be informed that they shouldn't drive for 8 hours after taking the medication. But still, over repeated usages, the side effect comes down. So in cardiovascular and peripheral vascular disorders, the lasmiditan is superior to triptans. CGRP antagonists, I have not used, sir, so I don't know how frequently they are available. I think they are not commonly available.
Yes, actually, that CGRP antagonists, or otherwise known as GPANTs, these drugs are actually, they are blocking that CGRP receptors. But what we are doing, these ditans are, they are stopping the release of CGRP. But here, GPANTs are blocking the CGRP receptors. The advantage of the GPANTs over the ditans is that you can use it as a preventive drug also for migraine, because it totally blocks the CGRP receptors. You can take any number of times. There is no overuse headache at all. You can take it as a preventive treatment for migraine, not only as a abortive treatment. Preventive treatment also can be tried in a GPANT. So now this is not included in our study. So we are just excluding it. And then next question is, how do you incorporate lasmiditan into the treatment regime of patients already on preventive migraine medications?
So this lasmiditan is for acute migraine headache episodes. though patients are on preventive migraine medications, they might on and off develop migraine headaches. In those situations, if the headache is mild, we can use NSAIDs also. If the headache is very severe, we can use lasmiditan.
Okay. This lasmiditan is used as an abortive drug. So prophylactic drug, the patient can continue the prophylactic drug, but for pain relief, you can take a lasmiditan. So that will give a good relief. And then next question is, can lasmiditan be used to prevent migraines, or is it only effective for treating acute attacks?
It is only effective for treating acute attacks.
Acute attacks. Yes. And then can we give lasmiditan with other migraine medications or supplements?
No, we can give, sir. So there is
Yes.
not much of interaction, so we can give. We can give along with preventive medication. Even with acute attack, when we use NSAIDs, we can give lasmiditan also. If there is no relief with NSAIDs, or if the headache is very severe, we can use lasmiditan.
Okay. Okay. So then last question is how to avoid sedation. So sedation is dizziness. Sedation is the mild side effect of this ditans. Yeah, I don't think that see all drugs which we are prescribing as a prophylactic drug and other things, they may cause some sedation definitely. But how to avoid sedation in this? If somebody is taking if too much of sedation is there, you can reduce the dosage. Like if you take a 200 milligram, reduce to 100 milligram, or in that way. So there is no other medication to improve the sedation. Just reduce the dosage. That is sufficient, I think. Can lasmiditan given in hemiplegic migraine?
Yes, sir. We can give lasmiditan in hemiplegic migraine. Triptans and ergots are generally avoided because of vasoconstrictive effect.
Yes.
There is theoretical risk of developing stroke. So, but since lasmiditan does not have vasoconstrictor property, we can use.
Yes, true. Actually, that we have to avoid triptans in hemiplegic migraine, or those who are having a classical migraine with auras. So this sort of people, better to avoid these triptans. But lasmiditan one can use for classical migraine or also hemiplegic migraine. It will not cause any vasoconstriction or producing a stroke. Is it safe in geriatric patients? Lasmiditan, is it safe in geriatric patients?
It is safe, sir. There is no contraindication except this sedation.
Yeah, definitely.
So we should inform them. They will have sedation.
Okay, I think it can be used in all age groups, except that it may cause some mild dizziness and drowsiness. That's all. So, which can happen with so many drugs. There is no problem in using lasmiditan in an elderly age group. I hope there are no other questions. Mr. Rajamanikam, sir, that what about?
Yeah, we can conclude the meeting, sir. Thank you for your valuable time and insights. And you both shared your experience and your professional experience and your teaching experience to all the participants. Thank you so much for giving your time and explaining all sort of things and all the queries which is asked by the participants put in the group also you cleared. Thank you so much.
I thank Healthcare Division for giving me the opportunity. Thank you very much for all the audience for participating in this program. Thank you. Thank you, Dr. Balasubramanian also.
Thank you, sir.
Thank you. Thank you so much, sir.
Thank you. Thank you.
Thank you.
Right, sir. Thank you, sir.
Thank you,
Recording
sir.
stop
Thank you.
பண்ணிட்டாங்க.
Thank you.
Yes,
Thank
sir. Thank you so
Thank
much.
you.
Flow ரொம்ப நல்லா இருந்தது சார். அதே மாதிரி அப்படியே
நல்ல speech.
கொஸ்டின்ஸும் ஆமா கொஸ்டின்ஸும் எல்லா கொஸ்டினும் மெதுவா சொல்லி அதுக்கும் ஆன்சர் பண்ணி டைமுக்குள்ளேயும் 35 minutesல முடிச்சு